Restrictive lung diseases are an incredibly complex subject. There's over 200 different types of restrictive lung disease, and essentially they're just grouped together by their performance on pulmonary function tests. So with restrictive lung disease, there's a reduction in the amount of compliance of your lungs. So if you can, I guess, kind of group in your mind that they have reduced compliance because they're stuck. So there's fibrotic changes in the lungs, and this causes less air to be able to be expanded and compliant. So less air can be used when it's inhaled. So this impairs the amount we can use, and this is why people with restrictive lung diseases complain of things like air hunger. So they're constantly thinking about air. They have anxiety about exercise because with exercise you can't get in enough air volume. So you have things like chest pain, you have fast, shallow breathing, and coughing that's usually non-productive, though depending on the type of disease. And this is why anxiety with exercise can be really important, because if we're not exercising and we're scared of exercising, it can contribute to sedentary lifestyles, which can cause deconditioning and worsening of the disease process. So what causes restrictive lung disease? So it can be intrinsic, extrinsic, or neuromuscular. So intrinsic causes are due to things like inflammations from conditions like sarcoidosis, which are little polyps in the lungs, or exposure to things like allergens or dust, such as asbestos, silica, or coal. So if you can think about being a coal miner, what are you exposed to? Coal particulates, and these can actually settle in your lungs and restrict breathing, which makes sense. Or it can be like things like fungi. So it's a very complex, multifaceted disease process, but it kind of presents similarly. And the inflammation from all of this intrinsic cause can lead to scarring of the lungs and then proliferation of cells, which then produce a fibrotic lung change in the lung tissue. So this just means that these scars are less compliant to air, so the lungs don't move as well, and then you can't breathe as well. So another cause is extrinsic. So extrinsic causes of restrictive lung disease include things like deformities. So these are things like scoliokyphosis. So these are people with rounded backs, which can be structural or functional. But if you can imagine being hunched forward all the time, your lungs can't expand because your rib cage function is related to your posture. So that can be one extrinsic reason. Also obesity. So being so heavy that your chest wall has trouble expanding can be part of an extrinsic cause. There's also neuromuscular things like ALS or muscular dystrophy that can impair breathing. And this is because if you're impacting that nerve that innervates your diaphragm and there's an injury to it, it's not going to work as well. So restrictive lung diseases have a reduced amount of volume that can be breathed in. And so part of the reason that these people have issues is because without use of your diaphragm, it's the primary, muscle of respiration in quiet breathing. So that could contribute to restrictive lung disease. And so some risk factors, it depends on the actual disease specifically, but generally increasing age, genetics. So I think African Americans are more at risk for sarcoidosis, your gender, your environmental exposure to things like dust, and even secondhand smoking can increase your risk for some of these intrinsic causes of restrictive lung disease, but also things like your diet and your BMI can contribute to extrinsic causes of restrictive lung disease. And so what are some treatment options for these conditions? So medications for restrictive lung diseases can be like corticosteroids. So these are things like systemically reduce your inflammation processes. Antifibrotics, so these are medications that can reduce the laying down of fibrin and scarring. Vasodilators, immunosuppressants, and supplemental oxygen makes sense because supplemental oxygen basically increases the amount of oxygen that gets to your tissues, even though you're not breathing in as much as you could be. With restrictive lung disease, it can often help function for these people. Weight loss, if you're obese, has been shown to reduce the workload of breathing. So again, taking the weight off of your chest wall can help breathing dynamics. So diet and exercise, obviously the first line of treatment for obesity, though gastric bypass surgery has also been shown to improve lung function tests. Surgery, in terms of scoliosis, can help, though it can also be managed with bracing and physical therapy conservatively, though surgical correction is available. Also, for people with end stages of restrictive lung disease, lung transplantations are always an option, though these are candidates with end stage like respiratory failure. Positioning can improve your breathing dynamics. So actually laying on your stomach can be shown to like improve oxygenation in patients with acute respiratory distress syndrome. So different ways of laying down or correcting your posture can impact your oxygenation and your breathing mechanics. And then we have pulmonary rehabilitation. So this is just a fancy way of saying like it's a multidisciplinary team effort with nutritionists, respiratory therapists, physical therapists, pharmacists, that kind of thing. And this is cool because it's been shown to improve walking distance, reduce fatigue, reduce trouble breathing, and improving quality of life, which I feel like this is the goal for people with these disease processes. And what do they actually do, right? So they consider your individual disease process, your comorbidities. So like if you're obese, you have hypertension or other diseases, obviously that's taken into account for your treatment plan. Breathing exercises and like retraining that diaphragm that we were talking about can improve the respiratory function. Strengthening the upper and lower body with resistance training. So whenever you have a pulmonary dysfunction, you're not just looking at the lungs, your quad strength or your leg strength and your upper body function is, it comprises your quality of life because we're not just one organ. So looking at the whole body is part of pulmonary rehabilitation. And also obviously aerobic exercise is incredibly important for these people because we know that VO2 max and lung function and physical function allows us to do activities of daily living. So if you can imagine being deconditioned and it being a workout to sit up from the bed and stand, that's just a different world, right? So we can do a lot of good for these people by just adding progressive function and rehabilitation. And so being sedentary obviously is part of pulmonary rehabilitation's goals is to reduce that. But you're also going to get services like education, so education on the disease processes, nutrition support for those with obesity, but also nutrition can be useful in other diseases because the amount of muscle tissue and the amount of health of your cells, so the quality of your recovery is a lot of the time dependent on what you put into your body in your recovery, and nutrition plays a big role there. Also, psychological support are also integral to the success of the pulmonary rehabilitation. So, that was a short little restrictive lung disease video, but I hope you enjoyed it. If you learned something, let me know in the comments, and I'll see y'all in the next one. Peace.